My name is Craig and I'd like to welcome you to this video demonstration of TajEmo eHealth. eHealth is a clinician-focused electronic health record, billing and practice management system, customized for the South African market to include all codes, NAPPI, ICD10 and procedures. TajEmo eHealth also handles scripting, dispensing, referrals and many other tasks. eHealth is a cloud-based solution. This means that it is hosted remotely, reducing infrastructure costs, implementation costs, and the risk of data loss. Because eHealth is a cloud-based solution, updates are delivered quickly and seamlessly. In this demo, I will be covering the following: the calendar, patient demographics including medical aid validation, clinician forms, vitals, SOAP, specialist forms, and other forms, dispensing and referrals, integrated billing, and financial reports. For a full live demo, please contact TajEmo at info@tajemo.co.za. Without further delay, I present to you TajEmo eHealth. Accessing TajEmo eHealth is done via your web browser. The user will be supplied with an access URL, a username and a password. The calendar screen is broken up into two areas. We have our month view and our day view. We can also change the scope of our view through various buttons. We can view all of our appointments. We can see patient appointments as well as meeting reservations and in and out times. The calendar can be viewed per user or for all users. In order to add a new appointment, we would simply go to the required time and date, search for our patient, select our patient. We can change the status of the visit to the appropriate status if required, and save. For practices that take bookings in advance, TajEmo eHealth can also find available time slots. By using the Find Available button, we can see that all the open time slots appear for the required number of days. If we select a time slot and a patient, we can save the booking and it will be put onto the calendar. To get a summary of the patient's details, we can click on the patient. On the left hand side we will see the patient overview, which gives us billing information, demographic information, medical aid information, clinical notes and the most recent vitals. On the right hand side we can see prescriptions, immunizations, scanned documents, surgeries, lifestyle issues, risk factors, family history, allergies, any other medical problems, special investigations and clinical reminders. One can also confirm medical aid details from within the patient dashboard. When adding or updating patient details, one can also fetch patient information from the medical aid. Here we can see the patient's visit history. In order to see more detail on forms that aren't already detailed, we simply put a mouse over and it will give us a summary. We can create a new visit from the drop-down and save it. Having created a new visit allows us to capture clinical and billing information. If we go to the Vitals screen, you can see that we can capture as much or as little information as required. simply save it. Here we can see the information as captured in the form. Amongst the clinical form, the SOAP form forms the foundation of the general practice. When capturing information, the user is prompted by suggestions. This makes it easy for a staff nurse to capture chief complaint. The assessment is captured through a pre-populated list of ICD10 codes by description or by the quick ICD10 selector. We can see that the ICD10 codes are automatically entered. Prescriptions can be captured within the SOAP form, and the user will be prompted, and ICD10 codes can be linked to prescriptions. Printing is also done within the system. Here the script items have been added to the clinical history, and we can save the form. Referrals can also be done within the SOAP form. Here we can see that the chief complaint has been pushed through to the referral. This is configurable for the user's preference. Once again, print from within the system, and we've added it to the clinical record, and we can save. Specialist forms can be created to suit any speciality. Here are some samples of specialist forms. HIV forms, other forms include IOD forms, as well as personal health assessment forms. Dispensing can also be done within eHealth. eHealth includes an integrated billing module. Here we can see the dispensed items have already been charged and are included on this fee sheet. I'm going to add a new consultation linked to the diagnosis from the clinical module. I will add a procedure as well as a material item. And we can submit it to the medical aid from within eHealth. And here we can see a summary of the responses. Claims can be monitored from the claims management screen. We can see various details including the charged amount, the accepted amount and the rejected amount. And we can go into further details. eHealth includes various reports. For the purposes of this demo, I will be going through the account summary, age analysis and sales report. The account summary is broken down into year, month, and medical aid. Here we can see the summary of payments due, payments paid by medical aid, due by patient, paid by patient, and any adjustments that have been made. We can also print a report from within this screen. Aged analysis allows us to view debtors' aged analysis for either all medical aids or specifically chosen medical aids. We can also exclude patient liable amounts or include patient liable amounts, include patient details or exclude patient details. We can also search by patient and print the report. The sales report gives us a rundown of sales of procedures, consultation, materials, or dispensed items. We can view this in summary or in detail. That concludes this video demonstration of eHealth. I hope you found this helpful. Please feel free to visit us at www.tajemo.co.za for more information. That's tajemo.co.za.